Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, welcome back to all of you who've been joining us to listen to all the latest information about our upcoming GOLD Lactation Online Conference 2023. We're super excited. We're getting closer by the day, and soon we will land on our opening keynote date, which is April 3rd. So go mark that on your calendar right now. And then you can head over to our website just shortly here at goldlactation.com to register for our open keynote, because it is free and open access to all of you. Now, for many of you, you've already registered for this event. So this is just exciting news for all of you to catch up with all the latest information from our speakers and what's coming up here at our conference. And today, I'm very excited. I have Joka Muyldermans, who is here with us today and going to be talking about COVID-19 vaccination during lactation, the COVALAC study. So welcome to you, Joka. It's great to have you here today.
Thank you.
So Joka, tell me, where are you in the world and what do you do?
Well, I'm based in Belgium, born and raised. So I went around the world for traveling and conferences and stuff, but the most part of my work is in Belgium. My first degree was a midwife, and then by working in primary care and doing a master's degree, I ended up doing the IBCLC exam because, well, I'm working in the primary care, so we see a lot of breastfeeding mothers and try to support them and help them, guide them through. But then, well, I'm by nature quite interested in new education. So I started teaching in midwifery school, but then at the end I ended up starting doing research at the university, and especially everything about breastfeeding.
Wow, that's amazing. So your career's really taken you into a lot of education, and I love to hear the research. Joka, that we're always looking for more research in this area. I mean, perinatal itself, midwifery, lactation, it's underserved. So having more researchers like yourself is just truly exciting, and just such an honor to have you here at our Gold Lactation Conference. Now, when I saw this abstract coming in about your topic, and again, I'll just tell people, COVID-19, vaccination during lactation, the COVALAC study, I was like, could this be real? Is it true? Honestly, it was a little bit in disbelief that someone had the time and, the research, perhaps grants and so forth and so on, to put this together. But this is looking amazing. Tell me a little bit about how this research came about, and how did you end up wanting to really look at it?
Well, it has a long history. So we have a professor pharmacy in Belgium. She's in her 30s now. She recently got a baby. Well, she got pregnant during the COVID period.
Yeah.
And so because she was teaching in Belgium, midwives can prescribe medication or certain medication. And so she's teaching the midwives for that part. And so she got really interested in everything which comes around with pregnancy, lactation and stuff. So when the COVID vaccination started, and again, we know that vaccination or even medication is almost never researched in phase 3 on breastfeeding mothers or pregnant women. So we said, like, okay, this is our chance. COVID vaccination is going to start with healthcare professionals where a lot of people are in fertile age. Let's just set up something directly through the ethical approval, and then funding was something like, let's take care of that later. Let's see what's going to come up. We just put like a call to mothers like, okay, are you breastfeeding? Are you willing to give us samples on certain times? And very, very quickly, we had a lot of mothers like, okay, yeah, I really want to do that. So we had a very big possibility of samples and of mothers participating, which was very good. So when you talk about a grant, that's more difficult. We all know that there is not a lot of money for breastfeeding research. So we started up without any budget. So we drove around the country to collect all the samples, put them in the freezer, try to find here and there some little grant, or so we all did it more on a voluntary base. Wow. We got lucky, so we got some grant or some help from the government in the end for the samples. So that was, but most of the work is on a voluntary base.
Well, that's amazing. And I mean, and appreciated, because we know how challenging it is. It's, we do need to see more monies obviously put into research, but in the meantime, appreciate the efforts that, of course, you're putting in and so many other scholars do. Can you tell me, were there other folks simultaneously doing what you were doing? Have you had any contact with other researchers around the world looking at similar factors?
Well, yeah, we have similar research on the same time. So it always like there was a PrEG-COVAC, the pregnancy COVALAC study, where mothers who were pregnant got vaccinated, and they also took samples during lactation afterwards if they breastfed, so that we can also take that part. So it's a little bit we're comparing and talking and helping each other there. And all around the world, some researchers started and that's something that will be in the presentation also. So I will compare our results with other results and the difference what we had, because well, the vaccination used in countries was different. So we can compare some vaccines with each other, which is not very or rarely done in other studies.
Wow, that's amazing. Well, I'm glad that I appreciate the fact that we've been able to do that comparison, and having that is going to be obviously really important. Tell me, were there things that surprised you about the results when you looked at them, or were you just in it for all the research? Tell me a little bit about some of the things that you may have noticed that were surprising.
Well, when we believe in the fact that vaccination can be, because we do know other vaccinations during lactation or pregnancy, so we know that it can be safe. So the results there are not that surprising, or are more in the thought that we were. But the fact that we do see differences in antibodies, immunology reaction onto different vaccine types, or after when you went through COVID and then got another vaccination, and what it does, what surprisingly, and that's, well, we took samples until 6 months after vaccination, and so that's even then we still find antibodies, so it's a long-term effect.
Excellent, excellent. Well, I'm excited to hear the full presentation. Honestly, I think this is really important. It carries a lot of weight in terms of, what we need to look at, safety and reassurance. And I think that it'll be interesting to hear how many conversations, lactation consultants are having with, families, and, what they're talking about. And now some, other things that they can add to those conversations, which is always going to be valuable, because we're here to educate families so that they can make informed decisions, right?
That's it.
Yeah, absolutely. Well, that's fantastic. Well, thank you so much to you, Yoka, for being with me here today. I'm excited to have you to be part of the live conference. So don't forget, folks, Yoka's going to be here and she'll be able to answer questions during the live presentation, as well as featured on our online forums for all of you who will be listening to the recordings. Now, a quick reminder for you who are all tuning in today, our GOLD Lactation Online Conference opens on April 3rd. There is still time to register, lots of ways for you to get in on some savings today as well. Join in your groups. I know there's lots of you coming in as groups and teams, and we're excited to have you. Bring all your conversations, all your research, and all the things that you know to this conversation. We're excited to hear from you. Thank you so much to you, Yoka Muyldermans, for being with me here today. It's been really good having you here.
You're welcome.
And thank you to all of you listening in once again. Don't forget to join us at goldlactation.com, and we'll look forward to seeing you very soon. Bye-bye for now, everyone.